box squat is a great way to assess your functionality of your pelvis and the connectors to the pelvis. That is the subject of this video, and what I'd like for you to do is to sit on the floor the way I'm sitting. It's just like a box squat. What I'd like for you to do is to not lean forward, not use your arms, not arching your back or using your neck, trying to get yourself up. So the side view of getting up, it's just like a helicopter taking off, is to just go up and slowly bringing yourself down. So the front view looks like so. You're sitting like this, you're not leaning forward, you're simply going up and slowly bringing yourself down to the floor. Are you able to do that? In this exercise, the trunk remains as one piece, nice and stable. From the foot to the knees, become the base for the thigh bones and the muscles and the glutes to lift me up. This is a movement where every part of my body, just like all the other movements, are involved, with the spotlight being put on the thighs and the butt. If you're leaning forward, you're using different muscles. If you're using your arms to lift your trunk up, you're using other muscles. If you're stretching or bringing your neck forward, arching your back, you're using the wrong muscles again. You are clearly getting up, but that's a dysfunctional way to get up. Every time the right muscles that are designed to perform a task are altered, you're creating a dysfunction in those patterns of movement, and dysfunctional patterns of movement lead to dysfunction, instability, in this case, of the pelvis. Instability of pelvis is pelvic floor dysfunction, which can show up in many shapes and forms. Sometimes in forms of incontinence, sometimes in forms of pains, erectile dysfunction, painful intercourse, chronic back pain, chronic sacroiliac pain, chronic hip issues, chronic hip mobility issues. These are all different chapters of the book, Pelvic Floor Dysfunction. So while you can have other things that may be feeding your problem, the one thing that is definitely playing a role is the instability of the pelvis, which is not necessarily being addressed properly when it comes to the treatment. I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine, California. For those of you who are in California but far, far away, or in other states or other countries, there's coaching opportunities that you can get the information on in the description box. For those of you who have subscribed to my channel, thank you for being part of our family. And for those who are following us on social media, thanks for being our fan. For those of you who wish to make an appointment to come in, all the information is in the description box, and I hope to meet you at my office. Until next time, take care.